All right, folks, I'm going to show two techniques, one strain counter strain, and then one mobilization with movement to restore eversion at the subtalar joint. These are self-mobs. So with your knee bent at 90 more or less, your foot hanging off the end of the table like this, it's a good idea to put a little towel roll, in this case my sock, against the table, because you are going to push the person's foot down against the table. This would be the starting position. The point of interest would be, that would be tender, would be right here at the posterior posterior tuber of the calcaneus, right at the joint line, or even in the body a little bit lower. So either of those places. I'm going to palpate that spot with my third finger on the foot to be treated. So if it's tender, then I'm like, okay, that's the spot that I'm going to work on. I'm going to cup the heel of my hand around the inferior aspect of the calcaneus, not the posterior, but the inferior part of the calcaneus, and so that this finger, sorry to flip you off there, to touch the tender point that I just pointed out on my other foot. All right. So in that position, I feel the tender point. I with my elbow straight, so I can deliver force. I'm going to push straight down against the calcaneus, pushing it into eversion. All right. But because of the two different directions of the facets, you take your other hand and cup that around the front of the calcaneus, so it's right up against the tibia, so right at the anterior aspect of the talus. And then you don't have to do anything with this hand. It's just your finger will hold the talus, so that when you push down with my watch hand, as my daughter used to say when she was little, it will rotate around the interosseous and cervical ligaments. So then you just hang out there and you wait for your 30 seconds. You might notice that I'm applying counter pressure with this elbow on the knee so that the leg doesn't just come up off the table. So you hang out there and you wait, and usually you would wait for 90 seconds. All right. Sometimes what you'll find, you definitely need your 90 seconds in this particular technique. Sometimes what you'll find is as you're hanging out there, you'll hear a where you might feel that the joint move, in which case if you feel that, then you're already done at that point. But otherwise, you just wait for your 30 seconds. Then as a follow-up, if you were there in person with your patient, then you could test eversion, and you would find that eversion, for instance, fibularis brevis, would not be strong. But then the follow-up would be perhaps to do a self-mobilization. So this is my same foot, and I've put the medial aspect of my foot against the table, so I can take my thumb and the side of my fist on the lateral aspect of the subtalar joint. So I can just push that straight down in the direction of my forearm, straight to the table. And then I can, with my foot, push the medial side of the foot into the table and then relax. And now we can just do contract, relax, or mobilization with movement into calcaneal eversion. And now you've restored your calcaneal eversion so that your midfoot might not have to compensate so much by becoming even flatter than you would want.